Hello, and welcome to Making the Rounds, a podcast by the American Medical Association featuring advice, interviews, and discussions on the most important topics impacting residents' lives and careers. In this episode, anesthesia fellow Chirag Shah, MD, and Laurel Road's Alex Macielak discuss federal repayment and private refinancing. This episode of Making the Rounds is one in a four-part series on student loans, student debt, and refinancing. As a disclaimer, every situation is unique, and it's important to do your own research before making financial decisions. Here's Chirag and Alex.
Most of our loans are initially through the federal government, and then we graduate and we're kind of faced with the task of starting to pay those off, putting them into forbearance, or signing up for a payment plan, or refinancing through one of the private companies that are out there, such as Laurel Road. Can you just go over top line what the difference is between federal repayment versus private refinancing?
So I think speaking specifically to medical professionals, very unique repayment situation. Number one, given large amount of debt, right? Almost always six figures, a lot of times over 200K. Unique employment situation where you're going to spend 3, 4, 5 years in training, making, call it 50 to 70, 80,000, as a fellow, and then obviously huge upside after that as a practicing physician. The expectation that you're going to earn a strong six-figure salary thereafter. A number of factors at play. On the federal side, and most people, when you're going to school, you take out federal loans. About 90% of all the loans outstanding, all the student loans outstanding, are federal. And I think it's probably even higher percentage within the medical world. So given that, the first strategy any physician should look at as you're exiting school and formulating a repayment strategy for residency and thereafter is examining those federal repayment programs you mentioned. During residency specifically, the income-driven repayment options, and there's three variations. There's income-based repayment, pay-as-you-earn, and revised pay-as-you-earn. All three of these ask the borrower to make their monthly payments based solely on their income and family size as opposed to what they owe. So instead of paying based on the thought that you owe, $200,000, you're paying based on your $50,000 or $60,000 residency salary, and that yields a monthly payment that's far more in line with your monthly cash flows. So,
but the thing to keep in mind there is that your principal is still building up because you're not covering the principal with the interest payment you're making.
True.
So your loans will be larger by the end of your residency or fellowship, what have you.
And that's going to be the case in basically any strategy you implement during residency. I mean, unless, again, you had a pile of cash or maybe a spouse who wanted to help pay on the loans, or a parent, or I was never a resident, but I couldn't fathom any resident having another job outside of residency. So unless you had those extra funds, whether you had refinanced, whether you are in forbearance, whether you are in income-driven repayment, high likelihood that your monthly payment isn't even covering the accruing interest on the loan. So that I think is a factor that's always going to be in play as a resident. Nice benefit of one of these income-driven options, revised pay-as-you-earn. The interest that's accruing that your monthly payment is not covering, half of that does not get charged to you. So to put some numbers to that idea, let's say you're accruing $1,000 a month in interest, which is a realistic amount for this given amount of debt. And let's say your monthly payment is $400 based on your income. So that leaves $600 every month that is not being paid off, and typically would just be your responsibility to pay, at the conclusion of the loan. In revised pay-as-you-earn, half of that $600 is not charged to you. So instead of being left with $600 of outstanding interest each month, you're only left with $300.
Is that $300 just forgiven then by the government, or?
The verbiage in the actual program is not charged. Okay. So I don't think they use the word forgiven, but effectively it's like it never even existed. And so this is incredibly beneficial to residents in this scenario, and it can reduce your effective interest rate, right? So if the interest rate written on your loan is 7%, but half of that unpaid interest isn't getting charged to you, well, your effective interest rate maybe is now more like 5% because of that benefit. So it's a program that wasn't necessarily intended for residents and fellows, but can be incredibly beneficial for them. One thing I would note, if you have a working spouse, when they're calculating your monthly payment, they're going to consider the spouse's income. So theoretically, you're making 60 grand and you have a spouse maybe making 80 grand, your monthly payment will be based on the cumulative $140,000 household income. So it'll yield a much higher monthly payment and therefore less interest that is not getting charged to you. So people who benefit most from repay are high student loan balance borrowers with a modest residency income and no other household income. That's how you reap the benefits of that program the most.
So that sounds like a great strategy for the repay. Is there any difference between the pay-as-you-earn versus the income-based repayment? How should residents think about applying to either of those or picking either of those if, let's say, they're married or for some reason are making larger payments?
Ton of nuance to these programs. For example, income-based repayment asks for 15% of discretionary income to go towards the loan, whereas pay-as-you-earn and revised pay-as-you-earn ask for 10%. Term to forgiveness, so outside of any public service type of work, if you were to stay in any of these programs for 20 or 25 years, making payments based on your income, at the end of that time, if there's any balance remaining, it gets forgiven. The caveat with the forgiveness through income-driven repayment is it's a taxable event. So theoretically, you have 100 grand forgiven after 20 years. That 100 grand is added to your adjusted gross income for that year, and you've got to pay a tax bill on it. So certainly a consideration in determining the optimal repayment strategy. But back to the nuance, the IBR is 25 years to forgiveness. Pay-as-you-earn is 20 years. Revised pay-as-you-earn is 20 years for undergraduate borrowers, 25 years for graduate borrowers, which a medical
Right.
professional falls squarely in that bucket. So again, a lot of little differences between these programs. Another one, for example, revised pay-as-you-earn. Even if you filed your taxes separately with your spouse, they still consider their income in calculating the monthly payment. That's not the case in pay-as-you-earn or IBR. If you file separately, they'll only consider your individual income in calculating the payment. So a lot of little differences, and I think if you were a resident or someone who's soon to be graduating from medical school, it's something you have to take a very close look at and do your diligence, do your research. We actually at Laurel Road built a student loan assessment tool that allows borrowers to enter in all of their loan financial information, where they work, if their spouse is working, if they have children, how long they plan to stay in residency, and all of these factors get plugged into the model we built, and we'll provide the borrower with a personalized breakdown of each of these programs, along with what things would look like if they chose to refinance. So it's a really helpful tool. I think that people who are kind of on the fence one way or another find a lot of value in, and it's free to use. You can use it as many times as you'd like. So a bit of information in a very complex decision, which I think goes a long way.
And you touched a little bit on this, but public service loan forgiveness, that is a 10-year forgiveness program, if I'm correct. And I guess for most residents, we're at not-for-profit institutions. So if you're in a 5-year residency, that's 5 years towards repayment at a much lower rate. And then you have to have 5 more years of nonprofit work. Is that the right way to think about it?
It is. And I think, one point that residents should really be aware of is if you're planning on pursuing this public service loan forgiveness option, which is a tremendous program. I mean, and frankly, if your residency program qualifies for it and you think there's even a chance you'll continue to work for a nonprofit thereafter, really no harm in setting yourself up for the program. It's not something you need to commit to. I think there's a lot of misconception around that idea, but nothing wrong with setting yourself up. And setting yourself up more or less entails enrolling in one of these income-driven options, which very likely would have been in your best interest even outside of the forgiveness program.
So does it make sense to refinance right away after you graduate medical school, or should you wait after residency?
It's a good question, and there's no, one answer. I think everybody's situation is different. I started talking about folks with a working spouse. If that's the case, these income-driven options really don't benefit you, and that could be a great reason to refinance right after medical school. Alternatively, you might be someone who plans to practice family medicine at a nonprofit for the duration of your career. That's what you're envisioning. If that's the case, certainly utilize income-driven repayment, and hope to have something forgiven through that public service loan forgiveness option at the end of 10 years. And I say hope because there has been some legislative discussion around the program. It's been proposed that they eliminate the public service loan forgiveness option as part of the most recent education budget proposal.
Would that be retroactively enforced, or just?
That is the big overhanging question that many borrowers are facing now. So, past precedent has always been when they change these programs, previous borrowers, people who've already taken the loans out, get grandfathered through based on the original construction of the program. That's what we would expect to happen here. So if you're someone who's 7 years into pursuing public service loan forgiveness and very likely have made career decisions based on that program and the relief it could provide, the rug likely will not be pulled out from under you. I would recommend, though, if that's something you're planning on pursuing, keep a very close eye on the legislative ongoings. Certainly, as exemplified by the number of income-driven options that exist, the program's consistently changing. Those 4 options rolled out over 8 to 10 years. It's an ever-evolving marketplace, even on the federal side. So maintain a good idea of what's going on relative to the program, and keep very close records of making your payments and where you've been working.
Yeah, and speaking of records, I think one thing I learned during my journey was, if you're at a not-for-profit, make sure that you filled out your not-for-profit paperwork, because you need to do that every year, is my understanding, for the public service loan forgiveness.
That's right. It's called the Employment Certification Form, which you can get filled out at your residency program. And it's not a stated requirement of the program. Quite frankly, I think it was probably introduced as a budgeting tool by the government to get a sense of how many people are planning to pursue this loan forgiveness option. But it is certainly recommended that you do fill it out. I guess, makes clear at the end of the 10 years that you were intending to have your loans forgiven that entire time, and had been working at a qualifying nonprofit institution that entire time.
So if I wanted to refinance through a private company like yours, and I wanted to do that because the interest rates are going to be lower, do you guys offer any limited payments during residency, or is it just a regularly structured loan where you have even payments throughout the term of the loan?
Yeah, it's a good question. We at Laurel Road were actually the first lender in the country back in 2015 to introduce a dedicated refinancing program specifically for medical residents and fellows. So at that point when the program was introduced, and since then, residents and fellows have been able to refinance their loans, lock in that lower interest rate as soon as possible, and people are eligible to refinance as soon as you've matched to a residency program. So even in your final semester of school, you could lock in this rate, and the monthly payment is $100 throughout the entirety of training, so residency and fellowship. You do need to tell us when training will end, so there will be a finite date which standard repayment will start, and the idea is that standard repayment doesn't start until you're a practicing physician, earning an attending salary, and therefore can far more comfortably afford a standard monthly payment. We even allow residents a 6-month grace period of sorts to continue making those $100 payments into practice. So you don't need to, in your first month of earning a six-figure salary immediately make a full monthly student loan payment. You can delay that for up to 6 months after the end of training.
So if you're paying $100 a month, your interest is still building up. So, for example, in the repay program, you mentioned that some of that interest is forgiven, but here that whole that principal amount and the interest will continue to build throughout your 3-4 year residency. Is that right?
It is, and so what you're looking at and what you're trying to determine is the effective interest rate via revised pay as you earn, with that loan subsidy component, is that lower than the rate which you could get via refinancing. So not necessarily
Right.
an easy, straightforward calculation, but again, that's part of the reason we built the loan assessment tool that we offer to borrowers, is to make those kind of decisions, because it isn't a straightforward one always. So that's a great question and something people should be aware of.
So if you go through private refinancing versus the government, do you lose any benefits, or are there any changes that occur if you're not backed by the government loan anymore?
There are. I think the high-level trade-off is you're trading the ability to utilize income-driven repayment, which inherently, is a bit more flexible. It ensures that your monthly payment will never be a financial burden, right? Your monthly payment is always a product of your income, and therefore, you'll never have a payment obligation that's out of whack with what you're earning. So there's, some inherent flexibility there, and that's only available on the federal loan. So if you were to refinance a federal loan into a private loan, you lose the ability to utilize those programs. Same goes for public service loan forgiveness. So can no longer, pursue loan forgiveness if you refinance. The trade-off with refinancing, obviously, is that you're able to secure a lower interest rate. So I, typically tell people, if you're someone who you're going to pay the loan back, you have no illusions of pursuing any type of forgiveness, you feel comfortable financially making a full monthly payment, refinancing tends to be, the best fit for those type of circumstances. Whereas, as we've discussed, if you want to work at a nonprofit clinic, you want to maybe or work at the government for that matter, or you're maybe unsure of your income in the coming years, the federal options tend to be a better fit. We have tried to mirror the benefits of our private loan program to the federal programs as much as possible. So, for example, we offer up to 12 months of forbearance should the borrower, come into any periods of economic duress, they're unable to make monthly payments, had to take a leave of absence from work, whatever it may be. You can put the loan with Laurel on hold for up to 12 months. And we also forgive the loan in the event of death or permanent disability. So same as the federal loans, anything happens to you, the loan is discharged, even if you had a cosigner. And that's a question we get asked a lot. If I have a cosigner on this loan,
Right.
Are they going to be responsible for it if anything happens to me? Simple answer is no, which I think people, have some security in.
That was Dr. Chirag Shah and Alex Macielak on federal repayment and private refinancing. Be sure to tune in for other episodes in this 4-part series about student loans, student debt, and refinancing. For more information on how to manage student loans, visit www.ama-assn.org/refinance loans. You can also subscribe to Making the Rounds and other great AMA podcasts on iTunes and Google Play, or visit ama-assn.org/podcasts. Thanks for listening.